Hi everybody, I am Dr. Indraneel, a practicing consultant diabetologist. My today's topic of discussion will be how to take care of heart in diabetes. In today's session, we will discuss about the diabetes, its complications and impact on heart, as well as preventive measures for people with diabetes to prevent heart disease. At present, heart disease remains the leading cause of hospitalization and death in patients with diabetes. Although most people have heard of heart disease, few understand exactly what it involves and in turn may not be taking proper steps to reduce their risk of heart disease. Heart disease occurs when blood circulating to the heart is slowed or stopped because of a blocked artery. What can be the reasons behind block in the artery? One of the major risk factors is high blood sugar level, also known as diabetes. Let us know what does the diabetes exactly means. Diabetes is a lifelong disease that affects the body's ability to control blood sugar levels. In simple words, it is a condition in which the body has too much glucose in the blood. Let's understand why does this happen. Usually when we eat food, the glucose enters into the bloodstream. Further, the insulin, which is a hormone, breaks down glucose from the blood into your cells to be stored or used for energy. With diabetes, your body either does not make enough insulin or can't effectively use the insulin to break the glucose. This leads to high blood sugar levels in blood, or what we call diabetes. Did you know diabetes can increase your chances of dying from heart disease? It's true. With diabetes, you are more likely to have a heart attack. So when it comes to diabetes, prevention is very important, as it can affect your whole body from your eyes to your feet and especially your heart. In fact, people with diabetes are twice as likely to have a heart attack or a stroke as people without diabetes. And it is reported that among diabetic people over age 65, approximately 68% die from heart disease. The chance of developing heart disease among people with diabetes is not dependent on how well you manage your glucose levels. So when we think about diabetes, we should really be thinking about heart disease as well. Moving on, let's see how high blood sugar levels lead to heart disease. High blood glucose can damage blood vessels, worsen cholesterol levels, and make blood pressure more difficult to manage. Persistent high blood glucose levels due to diabetes make the blood vessels prone to atheroma. This condition is a narrowing of the blood vessels due to collection of bad cholesterol. When the blood vessels narrow, blood flow has trouble reaching different organs in your body, including the heart. A sudden stoppage of blood flow to the heart may cause a heart attack. There are a number of things you can do to lower your risk of heart disease. Understanding the connection between diabetes and heart disease is the first step towards prevention. Diabetes is commonly referred to as a lifestyle disease. Managing diabetes requires patients to make significant and lifelong changes in lifestyle. These changes require a lifelong commitment from the patient. One can control blood glucose levels to help lower the risk of heart disease by changing lifestyle, such as eating healthy food, engaging in physical activity, regular blood glucose monitoring, quitting smoking, and overall, which is important, is relieving the stress. Let us see of these preventive strategies in detail. Number one, know your diabetes ABCs. A for the A1c test, that is the glycated hemoglobin, B for the blood pressure, and C for cholesterol. Now let's go for A1c in brief. The The A1c is a blood test that measures your average blood sugar level over the past 3 months. It is different from the blood sugar checks you do each day. You need to know your blood sugar levels over time. The A1c goal for many people with diabetes is below 7. It may be different for you. Ask what your goal should be. Regarding blood pressure, it is a force of your blood against the wall of your blood vessels. If your blood pressure gets too high, it makes your heart work too hard. The blood pressure goal for most people with diabetes is below 140/80 millimeter of mercury. It may be different for you. Ask what your goal should be. There are two kinds of cholesterol in the blood, the LDL and HDL. LDL is low density lipoprotein and HDL is high density lipoprotein. LDL is a bad cholesterol, can build up and clog your blood vessels. It can cause a heart attack or stroke. HDL or good cholesterol helps remove the bad cholesterol from your blood vessels. Ask what your cholesterol number should be. Your goals may be different from other people. If you are over 40 years of age, you may need to take a statin drug for heart health. Eat healthy and well-balanced diet. There is no one size fits all approach to eating healthily, but it is important to have a regular meal pattern and make healthy food choices. Your fat and carbohydrate intake are crucial to managing both diabetes and heart disease. Make simple switches from saturated to unsaturated fat. Having too much saturated fat can increase your blood cholesterol levels, so it's important to reduce the amount you eat and instead get fats from unsaturated sources. Switch butter and ghee for unsaturated vegetable oils and spreads such as sunflower, olive, rapeseed, or corn. Trim visible fat from meat and remove the skin from chicken. Choose lower fat milk and dairy products and swap biscuits, cakes, and chocolate for healthier snacks such as fruit. Remember, fatty foods are high in calories and excess energy results in weight gain. To help you manage your weight, it's also important to keep an eye on the total amount of fat you are consuming. Different fat types have different effects on the body. Diets high in saturated fat are linked to higher levels of bad cholesterol, that is LDL, in the blood. Eating unsaturated fats instead of saturated fat help to maintain healthy cholesterol levels in the blood. Eat right. Avoid refined wheat breads and cereals, potato chips and fries, red meats and processed meats, saturated fats, and sugar-sweetened beverages. Eat food with more fiber, such as whole grain cereals, dairy foods, beans and legumes, lean meats and fish, nuts, and healthy oils such as olive oil. Choose foods such as fruits, green leafy vegetables, bread and cereals, and low-fat or skim milk and cheese. Cut down on salt. Too much salt is linked with high blood pressure, a major risk factor for heart disease. Most of the salt we eat is already in processed foods. Check the levels and go for those with the lowest salt content. Learn how to read food levels to help you make healthier choices. Remove the salt shaker from the table to stop you adding extra salt. This is very important. Try adding flavor to your food using herbs, spices, black pepper, and lemon juice in place of salt when cooking. Here are some tips diabetic patients should consider. Number 1, eat balanced meals. Number 2, eat a reasonable amount of calories. Number 3, eat regularly at the right time. Do not skip meals to keep your blood sugar level down. And number 4, eat slowly. Try to maintain a healthy weight and engage in regular exercise. Weight loss may improve your cholesterol and triglyceride levels, blood pressure, and your diabetes. Start with low intensity, short duration workout and gradually increase intensity and time. Gradually increasing intensity and duration of exercise is important. Be careful if you already have complications of diabetes. Aerobic exercise such as walking, swimming, or cycling is recommended for patients for more than 3 days per week. Medical treatment for diabetes. Take your medications exactly as prescribed by your doctor. Eat meals and take medications regularly at the right time. Always remember that there is a risk of hypoglycemia if you delay your meal time or eat less than usual. Medications must be supported by healthy eating and regular physical activity. Quit smoking and stopping harmful use of alcohol are especially important. Unfortunately, many people who have diabetes, they do smoke. Smoking increases the risk of developing type 2 diabetes mellitus and its complications. It increases insulin needs and increases the risk of hypoglycemia. Smoking cessation is considered an essential part of diabetes care. Cope with stress as best as you can. Stress is known to raise blood sugar. Instead, try medication, deep breathing, or another relaxation technique to beat stress in a healthy way. Quality sleep is another key to good heart health. Get 7 to 9 hours of sleep nightly. The bottom line is diabetes can lead to serious medical complications, including heart disease, but you can manage the condition with medication and lifestyle changes. Avoid the most common diabetes complications with preventive tips. Thank you.